Let's take a look at some of the most common areas of concern for people who are diagnosed with BDD. Dr. Spann, can we talk about this? I know we mentioned the skin imperfections. Oh gosh, and then you talk about being a teen and even as adults and you have these imperfections, it consumes you almost.
Yes, and body dysmorphia is a disorder that is all-consuming for someone. And so when you're talking about things like skin imperfections or hair, facial features, that's body dysmorphia is to the point where someone is unable to focus on anything outside of that. It impacts their social situations, their ability to engage in activities of daily life.
Absolutely. And everything, well, we'll talk about body weight more, but there are some red flags that a person might be suffering from BDD. So as a psychotherapist, what are some of those red flags for you?
There are a lot of red flags. Certainly at the early onset, when we look back on something, hindsight's always 20/20. But what we start talking about is that we hear that people are unable to accept a compliment. That's sort of the most basic feature of someone who's struggling. They deflect. So, oh, you look great today. And someone saying,
oh, not really. I just kind of,
exactly. That type of response. And so what we're trying to do is teach, this is particular to women, but to teach women to say, thank you.
Yes.
And start accepting and hearing those words and hearing those compliments. Another one of those red flags is when someone talks about themselves in really disparaging ways. So I'm ugly, or I'm so fat, or ugh, this area of my body is really flabby. And so really sort of hyper-focused in a negative way on their sense of self.
Doctor, let's talk about treatment, because I think this is obviously really important. So how can you treat BDD?
There are a lot of different ways that we treat BDD, and so the best form of treatment is actually a combination of all of the things that's up on the screen. And so what we would say is that psychotherapy is really at the heart of the matter. Medications, psychotropic medications, can often be very important to get to a place where the therapy can actually occur. And then group and family therapy is a really critical place for many people because they have an opportunity to really talk with other people and share their experiences. The power of group therapy is really unlike any other, in which people can relate and connect to other people who are struggling in similar ways that they are.